I do not have a, thank you. Today, I do not have a formal structured presentation. We're going to do more of a sharing question and answer type of session. I've gotten a variety of questions from you across the network about a variety of different topics. So we're just going to go over some of those today. You should have gotten an email this morning with an outline of some of the questions that I've been asked. And so we'll just kind of start with those. Feel free to take this any direction that you want. If you have a question that you've been wanting to ask your peers, now is the time. Today is the day. You can come off of mute and speak. You can throw it into the chat. We'll do whatever works the best for you, and we'll manage whichever way works the best. So I'm just going to kind of look real quickly at that email and kind of read. For those of you that don't have it in front of you, I'm just going to kind of read what's on there and we'll just kind of dive in and get started. Some of the topics under quality improvement and governance are how are you doing your peer review processes, especially behavioral health processes? How are you structuring those reports? How are you structuring your quality meetings? Do you have committees and work groups and how do you delineate those? What are the responsibilities of each? And how are the notes or the meeting minutes from each of those shared? Who are they shared with? How are they shared? Under PCMH and reporting, does anybody have any best practices and tips for things that they're doing in PCMH? Are there any recently learned things that you've learned from your most recent renewal? Are you getting ready to go into transformation and you have questions for anybody? Things around patient engagement or data management. How are you doing your annual patient updates? How do you do your paperwork? What is in your new patient paperwork packet? What of that do you update annually? How do you do that? What do you have signed or noted at each visit? And quite a few questions around PREPARE, SDOH, the different screenings along with that patient paperwork packet, whether that's on paper or electronic, and kind of which way you're doing that. And then care delivery, clinical initiatives, how are you doing chronic care management? How are you improving your chronic disease population, patients' health? How are you managing annual wellness visits, well visits, not just Medicare, not just well child, but both of those, and also well adult visits? Do you have protocols around those? And then a recent question I got was, what are you doing with your people that are asking about GLP-1s? Do you have a protocol? Anything like that? So those are some of the questions that I've gotten. And so after kind of running through those, what's kind of percolating in the back of your mind? Do you have one of those that's like, oh, we had this and we did XYZ with it? Or I have a question about this other thing. I want to throw it out there and let's talk about that instead. Perfectly fine. But this is definitely an engage with each other session. And so let's just go ahead and get started with that. And let me find my chat. And we will just dive into whatever we can see we can do. But you guys are going to have to engage and share. So however you want to do that best would be great. So this is always easier to do in person, but it is very, very difficult for us to find a time for everybody to leave their clinics, come to a central location, and sit down for an hour or two and talk through these. So we're just going to do it this way. Who?
Right.
Yes.
Oh, I have one on the PCMH and reporting strategies. Um,
Awesome.
Excuse me. Sorry, I have to cough.
Go ahead, Dylan.
All right, my bad. All right, so we have one thing I really like that we've done this year is I think we had it last year as well, is our quarterly roundings with care teams. So we have a Zara scorecard that we keep that has the UDS measures plus like a resource measure, which I think is the appropriate. Um, um, yeah, there's the MedRec, and then there's the appropriate prescribing for respiratory conditions. With that, we are taking those to the care teams. We're reviewing it in these rounding meetings, and then that's meeting both like the care team engagement and the reporting requirements for the CQMs and the care team sites because it's at the that provider level how that provider is doing. Um, and then we talk through like our top like priorities for that, like usually based on either like the lowest measures or we have like 5 measures as an organization that we're really focusing on this year, and saying like how do we get to it or how do we improve. um, and then we have like a series of questions that are like what are your barriers, what's work like kind of what's working well, what is something that we can do as like the leadership or the QI team to support you, are there technical difficulties with like ECW, Azara templates, and kind of go through that checklist. um, if there's if it's an established team, we'll do a PDSA, but oftentimes with like our newer team members, we're really focusing on what are the core, like you can't really improve the process if you don't have the process established. So we're working on establishing the process. And then with and then in the past I've done rewards. So like if they meet their goal, then I provide chocolate. But chocolate prices have doubled. I don't know if you've noticed that. Um, like literally doubled. Um, Yeah, so I think that's just been a good thing, and it's meet several of the requirements for reporting and working with people to get engaged. And I think challenges wise is like our ECW tools haven't functioned the way that we think they function. And so like everything has to be tied to an active provider. And we've had a lot of turnover, and especially in like it'll be turnover in um, like October or sorry, like December or like January of the following year. And once the patients aren't associated with a current active provider, they just fall off of everything that like um, because that's how you enroll people through the PCMH program in ECW. So I don't know if anybody's had some uh, things to get around that, or if you even know that's an issue. Like it might just be that, like if you run it, I don't think if you run it and you don't like dig into it, I don't think you know that that's a problem.
I've heard that PCMH reporting with the different providers and being enrolled has definitely been an impact on some other health centers. So I will validate that, Dylan, that there are others that have mentioned that challenge. So back to your quarterly rounding. So you go to each care team quarterly with your dashboard
Mhm.
and kind of look and see where they're at. If they're well established and running the process as well, they might be doing a PDSA. Otherwise, you're doing some education on established processes that might be impacting those results. Is that kind of what you got going on?
Yes. So like across the clinic, like the last quarter or so, we like realized depression screening had fallen off. And so at that meeting, we set up a test patient and they pretended to screen me and would go through their steps and pull the templates. And usually most of the time is most teams don't remember there's a template to document the follow-up, the depression screening follow-up. But then we have the opportunity for them to practice and to see what they do, and then instead of like what they think they want us to think they do. Um, so I think that's been helpful. And then we can give some coaching and or like, oh no, that is a better process. We like that. Like that is more efficient.
Okay. And as you do these quarterly, are those all like I'm going to throw random numbers out there. So if you have 10 teams, do all 10 teams in the same month, or do you break them up and do three, three, and four?
Most of them have been in the same month because the first time we did it, we put them all in the same month. And as we go, we've been kind of trying to spread them apart a little bit. So it's less of a burden on the second month of the quarter. Currently, they're mostly in the second month of the quarter.
Okay. Does anybody have any questions for Dylan on their quarterly rounding? Sounds like it's not only working with their PCMH measures, but also keeping an eye on their clinical quality measures and catching deviations from the standard process early so it can get fixed. Anybody else have any patient-centered medical home type of tips, tricks, questions, thoughts? While you were thinking about that, recently, NCQA has updated their contract partnership with HRSA and the behavioral health designation, recognition,
Distinction.
distinction. Thank you. Behavioral health distinction is now also available through that partnership. And so that cost can be covered by HRSA. So if any of you have that or are looking at that, that is now part of that HRSA contract.
We just did that. We submitted last Friday. One part we didn't realize that was covered. One thing that people may need to know is that they need to put in the NOI, like behavioral health distinction, in like the either make a new NOI or do a on the one site EHB to be able to get that covered.
I know that there's been some discussions on whether you need to have two NOIs, one for patient-centered medical home and one for behavioral health distinction, but NCQA is really saying no, just do one of them. And so there may be a little bit of back and forth with that, but because they just started doing this, I think like November-ish. And so getting some of the communication and those patterns set. So there might be just a little bit. So should just be one NOI that should cover both of them, but it is a bit of a transition and a bit of a new implementation. And we all know how those can always have little hiccups in them. So, all right. What about engaging staff with your measures, whether it's a clinical improvement measure, a workflow improvement? How do you engage your staff in that?
Good morning, Heather.
Good morning.
I would love to hear how others do this. Currently, we have a Teams meeting monthly with all of our nursing staff, and we go over a lot of like workflows or where we are, kind of get their, we kind of work with them to see what they're currently doing and if we can do any improvements. Of course, we also have a clinical meeting just with our providers of different areas to kind of get their intake as well. And then we reiterate in our morning huddles. But I would love to hear how other places are doing this as well.
If you are somewhere you can't come off of mute, feel free to put it in the chat and we'll read that out of the chat for you. How do you engage with your staff at any workflow job description? How do you engage with any of your staff to engage them in a change that needs to be made?
Hey, it's Crystal at AmberMed. We have weekly huddle meetings with nursing staff, registration staff, behavioral health, whoever can jump on the call while the doctors are rounding in the mornings. I know our setup is a little different than everybody else's. And each department head brings whatever they need to that meeting to get everybody updated to what's going on, if things need changed, or if anybody's going to be out or what's going on. And then we do monthly nurses meetings during med staff for any clinical IT problems that's going on. And then after every peer review, which is quarterly, we have meetings with staff to look at what we're missing in the charts, what's not flowing over. And then we also have quality quarterly meetings to review UDS measures and QI in the clinic. Can I say I always get everybody on board when we have these meetings? No, but it's nice to be able to say, this is when we talked about it. Here's the handouts you got. If you need more help than that, then let's sit down and do one-on-one. I'm also interested in how everybody, if you're going to do rural health transformation, what's your, are you going to do a whole clinic meeting? Are you just going to sit down with the heads of departments and figure out your quality? I'm kind of anxious about that, and how, if anybody has any ideas of what they're going to do with that.
I heard you mention handouts. Do you do handouts regularly? Like, we're making a change, this is the process, here's the handout so you remember how to do it. And then do those go into like a reference for, say, a process that doesn't happen very often, or somebody's floating over from someplace else? Tell me more about your handouts.
We have training guides for new staff, and then we kind of add in new flows to those. And I also email screenshots and whatnot out to the clinic staff when we change a process IT wise.
So when you're making some IT changes, you kind of are the liaison between IT and the clinical staff?
I kind of am the IT for clinical.
Okay.
Unless it's over my head or I have to get next gen on the phone. But most of the time it's me and next gen figuring out our clinical flows.
Okay. And in the chat, Kimberly, and she is from Health Ministries, they have practice managers that review reports every other month with each practice. The reports are clinical quality measures, or are they performance? Are they, what type of reports, and how drilled down do you go? Clinical quality, okay. And you work with those with your providers or your full team on your clinical quality reports? All the measures and the full team. Okay. Do you do handouts? Do handouts. And do you keep those for reference for a look back, and it's like, well, we talked about this and here's the process? Let me ask that question to the group. Who on the call has a reference book for your patient care flow? This is how we do check-in, this is how we room the patient, this is how we do and document the tobacco screening, depression screening, prepare screening, all the things, prevent screening, ASCVD, all the different whatevers we're doing. Are those written? You can just throw that in the chat.
Hey Heather, this is Joseph from Health Partnership Clinic. I'd say that we have some processes that are written down and could be used as handouts when certain things in our EHR change. If there's enough notice or if it's significant, we'll take screenshots and create workflows. Those exist as like at request for that particular thing. It's not like there's a binder or a folder on any of our drives that staff could just go access. Um, to answer our approach to the kind of broader question, I would say that there are maybe three levels, if I were to make this easy, where informs like process change. The first and the slowest would be the strategic plan that happens annually. That gets reviewed, and upcoming policy, procedure, workflow changes are typically nested into solutions to improve strategic plans, and then that gets kind of a marching order for the upcoming year. During that year, there are several different avenues for how workflow changes get promoted. So quarterly, there are provider meetings where information is relayed to providers. We also have a quality improvement committee internally that meets quarterly to review things like related to strategic plans, or that's the quality measure focus if it's not already listed in the strategic plan. That's where we can address the UDS measures that are slipping. It's also an opportunity for information to go bidirectionally, right? Like we in quality, like look and are at our UDS measures, say, hey, this is an issue, and we get to talk with our providers to see like why is this a problem. And so during those discussions, typically is where suggestions or ideas to improve come up. So we will choose a particular UDS measure, or a staff will take ownership, like, hey, I really want to work on improving colorectal cancer screenings or whatever. And those happen quarterly. We also have department meetings, like our front desk staff will meet. I don't know the cadence of those, but if there are workflow changes, those get promoted there. It's maybe not so much about buy-in as coaching, but a little bit of both. And then even more regularly than that, there are monthly governance meetings. That's just what we call them here, but that is oversight of EHR stuff. It's the same kind of concept. What's working, what's not, what workflows need to change, what hiccups are we running into, and what are those solutions. When those changes are released, as you know, pertinent stuff comes out, all staff announcements are either emailed or sent through Teams. And then there's also determining which staff need to know things. For instance, we just partnered with Upstream for contraceptive and like reproductive health care. And that was localized to like our medical assistants or OBs. So it's all in the same swim lane. And then the last bit is urgent errors or issues can be relayed during morning huddles that happen every day. And that's kind of, again, to address immediate things. And yeah, there's variables at all of those levels, but I think that that's a comprehensive overview of our solution.
Okay. Going back to your quality meeting and your agenda, you said you had different measures or whichever on your agenda, and if something's slipping, then that might get added onto it. For those measures that you identify a challenge with, are you doing any data auditing before you go into that meeting, or anything to kind of dig into that measure beforehand?
We will. I would say that the digging into it is just sort of my typical like day-to-day stuff. Prior to those meetings specifically, we can just to, I don't know, cross-reference what the provider's gut checks might be, or to, pinpoint questions to be like, we notice, that this demographic's missing, or that this issue is worse in one of our offsites or whatever. It is never done to be like punitive. It's just only to show like a lens. But yeah, so the short answer is like sometimes we can glean information from those data audits, other times we can't. So yeah, we try to is the short answer to that question.
Okay. And it probably depends on what the measure is and what's going on with it. But I was just curious if you had done any diving into the data to see if there was an IT data input, data reading sort of issue versus a in the visit process. I guess what I'm saying is, are you looking at it to see if it is a reporting issue or a care issue? Is I think the
Y-
easiest way to say that.
Yeah, I think our priority is a care issue that would be reflected through our reporting. Yeah, I don't know. We're currently like doing a deep dive into Azara right now just to make sure that our reporting is accurate. But yeah, I would say that the focus is care. Because yeah, there are intangible things or stuff that we aren't using as like data elements, following up with patients or um, I don't know. Hard to think of those intangibles now, but um, yeah, the focus is care.
Awesome. All right, we've got a few things that have been added to the chart or to the chat. I had asked the question on who's got like documented workflows, and we've got a yes, not sure, use handouts, and Chrissy at Mercy and Truth, they use handouts and they store them in the Teams channel so they're easy to access. Dylan at Hunter, they've got some, but they might be outdated, and they have a summary sheet that is more abbreviated, and they make changes with major revisions. Denise at Kanza, each department and provider has their own procedures. Some are in an ODP, but others not sure. And the ECW team at Kanza has created PowerPoint slideshows during clinical teaching for the measures and how to document them. And they also track specific measures on the UDS quarterly, and those are what they focus on for the quarter. And Karen at Vibrant, they've been working on and have put together a manual along with some videos that walk through how to meet different measures. And they also have done some quick and focused trainings with their MAs to go over areas where adherence has been lower, and to make sure everybody knows how to use the available resources. So it sounds like there's some variety. And I don't see it, but I thought there was one that somebody had said they're not, but they would absolutely take a copy of somebody's workflow to work off of. If anybody is willing and able to share any of their workflows, if you want to send them to me, I can collate those. We can drop them in the forum online. Um, I am a firm believer, and if somebody's created something that I need and I just need to tweak it, it's a whole lot easier than starting with a blank Word document. So if you are in a position where you can share any of your workflows that you've created or processes, that would be great. It does sound like that there's kind of a variety, and there's some health centers I know have been doing some very intense work on their workflows and their EHR setup, working with their Azara setup, and getting some of those things in place. Let's see. Let's kind of stay on the quality meeting topic. We've talked a little bit about agendas. What is on your quality meeting agenda and who attends it?
This is Brenda from Holy Family. We have our quality team is made up of one MA from, we have two nurses stationed, so but from both nurses station, one front office person, and then our quality director, and then myself. And occasionally we might ask medical records or someone from the back office to come in if that's necessary. But at that point, then what we're asking is that the staff take it back to their coworkers in their area. And so that way we're hoping that this information gets dispersed.
Do you have any sort of checks and balances that you check to see that that information has gone back to those department staff?
Well, it'll come up in our daily huddle sometime,
Okay.
know, that, quality team met, and, these are the measures we're going to focus on these next 3 months. And, or, it's back to school time. So, make sure you're getting the kiddos scheduled, and, whatever's appropriate for the time being.
Okay, thank you. Joseph at Health Partnership says the head of each clinical department participates in the quality meetings and distributes it to their department. Joseph, is that quarterly or monthly?
That's quarterly.
Okay. So who meets in your quality committee and what is on your agenda topics? Feel free to put that in the chat or come off of mute.
For us, we have kind of like a combined, or our QI also has oversight of our risk program at the moment. But we've been kind of breaking that apart slowly because we have a dedicated risk. We're forming more of a dedicated risk team that can go deeper into the actual incidents. So usually we start with some level of risk management, but a very high level. Then we'll have a clinical quality review piece, which is going to be like our discussion about peer review, like overall results of peer review. And we kind of cycle through like dental, medical, mental health. We'll then look at quality measures, how like general overall quality measures, and if anything is trending in the wrong direction, discuss that. And then we selected one focus measure. So like right now it's hypertension that we're going to do deeper dives on. After that, we go to KPIs. I have like a cycle of different KPI. We have essentially broken out into 6 sections that we review like twice a year. So like last month, we really focused, especially since it was pre-PCMH, we focused on PCMH specific measures. We will do, yeah. And then if anything's particular is coming up or like there's a big gap or we're redesigning our measures, we'll talk about in that section. And then we end with any action items that we've had from any of that conversation, or the team can bring in new things that they need to discuss with the QI Council.
Okay, and it sounds like you meet monthly?
Yes.
Okay. Thank you. Let's see. In the chat, we've got a couple in the chat. Brenda at Holy Families, their topics are generally to up-to-date information, including areas of opportunity to improve performance. Michelle at Health Ministries, they have a QI/QA committee, and they have all of their department directors, CEO, COO, CFO, satellite location representatives, quality staff, grants, safety officer, IP, employee health, nurse, and risks compliance staff meet on the committee, and they have an annual calendar, but add any new business as needed, and they meet monthly. Danielle, I'm drawing a blank. Which health center you're at? I am so sorry. Danielle, most of the, she has a question asking, what's jumping around? Danielle's asking, do most of you have just other members from your departments on the quality committee? Theirs tends to be those in more of a leadership type position. First Care. I am so sorry, Danielle. I knew I was going to say it wrong if I tried to pull it out of my head. Thank you so much. So Danielle at First Care is asking, do you have just your leadership, or do you dive down into that more in your committees? Maria asked a question. Does anybody have anybody from the board on the quality meetings? Michelle Health Ministries, they have a board member. Andrea at gonna start getting people wrong. Andrea at Always, they have monthly QIRM, their CEO, COO, CFO, nurse manager, behavioral health and dental directors, risk and medical directors, and they have 1 or 2 board members. Dylan is answering Danielle's question that theirs is leadership. Gregory put a beautiful bullet point list of their improvement agenda. Chrissy at Mercy and Truth has a board member present, and Natalie, they meet quarterly. Natalie at Mercy and Truth, they meet quarterly with all staff, including a board member. Dylan, they used to have a board member, but now they have a dedicated board quality committee where they take reports to. Dylan, we're going to come back to you on that one. Joseph is answering the board member on the quality committee meeting that they have quality sections during the board meetings, but not board during their quality meetings. Brenda at Holy Families invited the board members and they participate at whatever level they would like. Penny at Kanza, they review incident reports during their quality meeting, updates from health information. Oh, it jumped. Hang on, I gotta find it again. Updates from health information and EHR staff, family planning updates, QRM updates, quality improvement updates. Safety management is quarterly. They review reported events and review selected quality performance data, grant information related to quality measures, and they have someone from each department and a board member and an admin at their meeting. Melanie at Health Corps, their QIRM team meets monthly and includes the entire interdisciplinary team from each department of the clinic. And Monica at Grace Med, they meet monthly and they do have a board member in their quality improvement committee meetings. Awesome. Sounds like quite a few of you do have some board engagement. Joseph, thank you for putting that agenda in there. I will let you guys take a look at that. It's very comprehensive. Let me look through here and see. Dylan, can you tell us a little bit more about your board quality committee?
Yep, it's a committee with 3 board members. So it's like a board level committee. So it's not like our QI is more leadership within the organization based. They have their own KPI, which I mean is auto populated from the bigger organizational KPI, where they've set their own goals and benchmarks that they want to monitor. It is relatively new, so we're still figuring it out and what it looks like. But they've been reviewing like our, and they're kind of like the precursor to going to the full board with some of our QI actions. So like our review of our annual service area review, our strategic plan, our what else have they reviewed? Our monthly board report our monthly board report. I think maybe the risk report, quarterly risk. Actually, I'll follow up with them about that today. We've hadn't had it that long. I think we might be approaching a year now. But I think it's been good because then trying to schedule like the board member to come to our QI wasn't like, we've had some hiccups there, and I think this has been a little more manageable.
Got another question to the group. Who does the monthly quality report at your board meeting? And that's a question for the whole group.
Heather,
Health Ministries. Oh, go ahead.
I do ours at the board meeting.
Okay. And I'm sorry, it didn't highlight you.
I'm Shauna.
Is that Shauna? Okay,
Yeah.
Shauna, thank you. Michelle at Health Ministries does as the Director of Quality Performance. Health Ministries is the CCO. First Care is the Medical Director and the Quality Manager reviews it. Holy Family, the CEO, gives the report as completed by the quality staff. Salina Family, the CMO does, and Grace Med, CEO, COO, and Amber Med, Quality Coordinator. Okay, so a variety. Awesome. Let's see, let me look. Does anybody have a question that has come to mind in our discussion, even if it is completely unrelated? If so, throw it in the chat, because I do want to make sure that if you have questions that come to mind, that we prioritize the questions that you have right now. So if you have a question, throw it in the chat. I'm going to look over here at my my starting list and see where we're at, Does anyone use drives for the majority of their PCMH reporting? That's a question from Health Ministries. Drives does have the PCMH report, which is nice because it has the utilization measures on it. Those used to be really difficult to report. Who that has Azara and is PCMH recognized uses the Azara PCMH report? And what else do you use to support your PCMH reporting?
We've been using Azara for a lot of them. We used, but often what we do is what we've done the last couple of years is we have the Azara reports and then we have the ECW reports. And during our UDS process, we're doing like a thorough review of both and getting kind of like the best data that we can with the combining those data. And then what I'm doing is essentially taking a subset of the patients who we're assigning to each facility and getting a more detailed or a more specific report. Yeah, and so most of the numbers are coming from Azara if they're not part of that UDS process.
Okay. Joseph from Health Partnership says they are cleaning up their drives, but there's some metrics that can come from the EHR and blending it with the drives data. Any other comments on PCMH before I jump to the questions in the chat? Okay, going back to board and quality, Danielle at First Care asks, do those presenting to the board go every month or just put it in the packet for the board members to review? She attends quarterly and provides a report the other months. Diana at Prairie Star asks a similar question. Does everyone give a monthly report to the board? Their quality coordinator gives a report quarterly. Michelle at Health Ministries reports to the board quarterly, and they have the quality calendar and plan approved by the board. So the question is, how often do you go to the board meeting versus send a report to the board meeting? Andrea always provides a smaller report monthly and attends every other month for a bigger report. Jennifer at Salina says they do an annual quality report and a monthly quality focused topic. Maria asks a follow-up question. If you go quarterly, does the board packet include quality metrics monthly? Natalie from Mercy and Truth says yes. Okay. Go ahead if you, oh, there's another one. Danielle, at First Care, they provide their quality report and minutes monthly, and the quality manager attends quarterly. Okay. If you have an additional answer, go ahead and put it in chat. And I'm going to ask the question on peer review for behavioral health and dental. How do you configure that? Like how many patients, like how do you pick your population? Who does the review? How is it reported out? So let's start with the question, and you can throw a yes or no into the chat. Do you do peer review for dental or behavioral health or any other non-primary care service lines? Okay. So Danielle, at First Care, they pick a random 10 patients from the quarter and they use a third party for behavioral health and dental audits because they only have one dentist and behavioral health provider. Kim, Health Ministries, they do all service lines. Do you, follow-up questions to Kim, do you do that in-house or do you do that? Yeah, do you do that in-house among your own providers or do you have an outside entity review? Diana at Prairie Star Dental does quarterly peer reviews. And Andrea always, yes, all of theirs do peer review. I know I've gotten this question both for dental and for behavioral health. If any of you have a checklist or a check sheet or a guide that your reviewers follow, if you would be willing to share that, I know that would be very much appreciated. I can de-identify it if you would like that. We've got more in the chat. Brenda at Holy Family, they have both service lines completed quarterly by the CMO. Your CMO does your behavioral health peer review and your dental peer review. Did I understand that correctly? I'm not challenging the answer. I'm just making sure I understand.
It's behavioral
Joseph at
behavioral health and primary care.
okay. Joseph at Health Partnership, they do peer review quarterly at the same time as primary care and pediatrics, and it includes dental hygienists in-house. They randomly select visits and assign to another provider for review, and the CMO reviews the results. Okay. Kim at Health Ministries, they do theirs in-house. The quality team does the review 2 quarters, and they have a provider peer review committee that completes the other 2 quarters. That's a neat division. Danielle at First Care Medical, they do 3 of the 4 in-house, but once a year they have the coding network do medical as well. Just so, like what little floating thing in the way, just so they have 1 annually for medical done by a third party as well. Crystal at Amber Med, they do medical behavioral health random 10 patients per provider per quarter. The CMO does medical, the lead behavioral health person does behavioral health, and they are searching for dental to outsource. Anybody have extra dental? Amber Med could really use that. They're also looking at changing the amount per quarter to a percentage of patients due to the time that it is taking from providers serving patients. And Dylan at Hunter, they do for dental and behavioral health, the number and the selection process he doesn't have at hand, but it's a random set of charts most months. And in some months, they focus on a particular area. They were going to get a third party, but decided to keep it in-house, and each dentist reviews charts from each of the other dentists, which provided better learning opportunities, and they have a checklist tool that they use. Maria has a follow-up question on coding. Do you have a coder in-house to do follow-up education, or do you contract out for coding education and follow-up? Which leads to another question. Are you looking at coding in your peer review? Michelle says they contract out for coding app audits, and that happens twice a year for all providers, all service lines. And RevCycle does coding education post-coding audits. Okay. This is awesome, guys. Thank you so much. I know this is very useful information to the people that I had asked some questions around this. Diana Prairie Star, they do 2 chart audits for coding per provider. Crystal at AmberMed, they have a contract provider that does coding audits. Kim at Health Ministries, this month they did a focus on BMI, and coding was included, and provider education was made and given with their peer review scorecards. I love that you're using it for education. That's amazing. Danielle at First Care, their providers review coding at their peer review. However, that's why they like the coding network at least once a year, because they definitely catch more than our providers do. I'm familiar with the coding network, and I really liked working with them too. They were very good at explaining why this coding was incorrect and breaking it down between this is going to get you in trouble with your payer, and this is just leaving money on the table, kind of differentiating what the legal risk was to different coding errors. Not advertising for them, just a familiarity with that company. I had also gotten a question from somebody on where to find an outside peer review entity. And KFMC does do outside peer review. They have contracted peer reviewers for every specialty imaginable. It is not a set rate. It's like on time, like a time basis. And that makes sense, because if you have a big chart that needs to be reviewed versus a 3-page chart that needs to be reviewed, it does have some differentiation. But that's somebody had asked me that, and KFMC is one that does that, and they have. I knew it when I answered to that individual person, but I cannot draw it out of my head. But they do have like a national designation or recognition for doing validated peer review. Crystal at AmberMed, does anybody do peer review on dental hygienists? I did. I think I saw somebody. Let me scroll through here. Joseph at Health Partnership mentioned they do dental hygienists in-house. And Kim at Health Ministries, the dentists there review the hygienists. And we have a request for a dental hygienist peer review page, checklist. That would be awesome. And Michelle at Health Ministries, after the dentists review the hygienists, the dentists meet with them individually. And Danielle, Michelle, if you need emails to connect, let me know. I think you can also message directly in the chat. Oh, there. If you guys, and part of this is to kind of build connections. If you guys want to reach out to each other, you have a follow-up question for somebody, go ahead and make those direct connections. You don't have to connect with the other health centers through me or Maria or whoever else you contact with. You are free to connect directly. And I'm hoping a little bit by doing some of these conversations that it might build some of that, build some of your support network. All right. Any more questions around peer review or coding review?
I'm gonna put my little blip in here. So as of today, the new FQHC billing and coding manual is on the resource in the resource center on the website. It is getting published. You will get a constant contact, everybody will, but for those that use this can be used for peer review. It does include dental and vision now. And so everything from medical to behavioral health, substance abuse, and now in dental and vision have been incorporated.
All right. Any other follow-up questions on peer review, coding review? And let me just say, I am so thrilled Maria is here with us that she can answer those coding type questions, because that has been, I needed somebody like that when I was at the health center myself, and I'm very glad that she's here. She's extremely knowledgeable. If you have coding type questions, absolutely reach out to Maria. I can definitely connect you with her. But I am not your expert on that. So, um, just I'm very grateful I don't have to try and figure out the coding questions anymore. All right, let's see. Annual patient paperwork and paperwork updates. How do you do that? Does everybody get a paper packet? Do they get it ahead of time? Do you send anything out in mailers? Do you send out an electronic link? Do you print it if they've been there before? Do you print out a copy of it and they initial their phone number and address? Do you have scripting for your front desk staff to capture changes? The one that gets me is everything the same? It's like, I don't know. What do you have? I got asked that one time and I'm like, I don't know what my daughter has on her information. She's 28 years old and she's blind, so I'm just trying to help her. So, how do you manage that? Because I can see it a whole lot of times that somebody comes in, it's been a year, they had a phone number change 9 months ago, and to them, yeah, everything's the same, but it's not the same in the record. All right, the chat is popping, so let's hop over there and take a look. All right, Danielle, First Care, they use Luma. Maria has a question around who's added AI statements to their patient registration. Salina family, they have a separate consent for AI. Hunter currently is using a paper packet, but experimenting with Helo check-in. Amber Med is also using Luma. Health Ministries is using Helo for most of it, but a few things on paper, like the sliding scale form and the communication authorization. First Care gets the link to complete everything before they come in, and always uses Helo, Form Doctor, and paper. Health Partnership is starting the switch from Helo to Phreesia. Okay. Holy Family is doing Helo and Doctable, and Salina, they use Athena to send the paperwork out. Maria, thank you for your help. Have fun at the NCQA training you're going to, and we'll talk to you later. First Care, they had used Phreesia, and they went to Luma. She preferred Phreesia over Luma. Non-English, non-Spanish. How do you manage those patients? And then as the mother of a blind child, how do you manage your patients who have visual? And I'm not asking that in a mean kind of way, but I've been with my daughter to many, many appointments where they'll hand her a clipboard or they'll send her a link to a portal, and neither one she can read. So that it just is an awareness, not a criticism of anybody, just an awareness. Phreesia, Dorothy, always their Phreesia or their ECW didn't work well with Frisia. Holy Family has staff to assist patients that need help with their documentation. Vibrant is using Frisia, and their patient access associates also reach out to help support newly registered patients and get them set up. Let's see. I wish Genesis was on. Do we have anybody from Genesis here? They had, and I
Yeah, I'm
assume they
here,
still have it,
Heather.
but they had a process they put into place a couple of years ago. And so they basically have a yearly appointment for their patients, where they would come in, they would go through all of the paperwork, all of any of the screenings, the sliding fee scale, all of everything paperwork and administrative related every year. And it really helped them capture their financial status of their patient. You know, where on your UDS you report what the financial category of your patients are. Really help them with that, help them get their screenings more consistent. And I wish they were on here to do that. I don't know if they've had any staffing
I'm
changes
here,
that may
Heather.
have
Robert's on.
Are you? Oh, there you are. Yes, Robert,
Yeah.
tell us about your patient intake process.
Yeah, every year they have to come, the patients have to come in and kind of go through that approval process. They also redo their schedules and for their sliding fee scales rating and do all that. It really has helped our UDS, making sure we have all those boxes checked, and then it takes a lot of load off the front desk. They actually just schedule when they come in to schedule an appointment. The first thing they do is schedule an appointment with the O&E people to sit down and go through all that paperwork and make sure that it all gets answered. They have the option to kind of pre-do it and get it done and speed the process up a little bit. But if they're having language or whatever issues or understanding or whatever, they can come in and sit down with the O&E and they will help them through that whole process, checking in. So.
Up, I was trying to scroll through the list and I just did not find you. Now, O&E, that is outreach and engagement staff.
Right. Yes. Yep.
Are any of them CHWs or anything like that, or what are what's their
I'm
training or
not sure.
background?
A lot of them were going through the CHW training, and that was kind of kept. Once they got that training, then they became CHWs and weren't O&E anymore. So, but
Okay.
yeah, they're kind of along the same line. So yeah.
Now, in your O&E appointment with your patients, do they do any of the depression screening or any of those screenings? Or is it strictly administrative paperwork?
It's strictly administrative paperwork that they do, right? Yeah. So.
Okay, perfect. All right, and I've seen the chat over here popping. Let's see.
See one of them pop up said everybody has to go through the O&E process when they come in. They have to go through that. So.
Do you do the prepare or SDOH screening at your O&E meeting appointment?
I know they used to. I'm not sure where the prepare part of it, and the social determinants of health. That was a lot of the reason they were doing it, so we could get those social determinants of health done. So yeah, that gets asked by them or make sure that gets filled out.
Okay. And Robert is at Genesis Healthcare. Had a question on which center you were at, Robert.
Yeah.
And we have a question from Always. Do your commercially insured question that O&E appointment?
I don't understand that question. But they check the insurance to make sure the insurances are valid or verified and that the insurance are valid, so that we avoid that at the desk or later on, that making sure that they have, that their insurance, all the numbers are right and everything is going to process properly. So yes.
So kind of doing an eligibility and making sure you have the most recent card on file and all of
Right.
that good
Yes.
stuff for your commercially
Right.
insured. Okay.
Yeah.
And is there a charge for this O&E appointment, Robert, or is it
N-
at no
No,
cost to the patient?
no.
Okay.
There was some talk at one time that it's actually could be, there's parts of it that could be billable to insurance or whatever, but I don't know whatever really came of that. But yeah, but the patient doesn't pay anything for that. No. Yeah.
Okay. All right. Any other question for Robert about their O&E appointments? Okay.
Oh, do you have
Have
anything about like what were some of the barriers to getting that started, or things that you overcame to do that, or maybe some unintended like ROI or
I think getting the people trained that of the process of getting of what had to get checked off, what what they were there for, and the process that they needed to go through to get it done. I guess that became an actually everybody on everybody's heart understanding the check-in process and those critical things that had to be asked and done and those things. Hugo designed a pretty powerful Power BI script that scans the check-in, the questions and answers, and they could actually generate a report like on a monthly basis that, hey, there's like 10% of our people aren't answering this certain question on maybe it's the smoking or whatever. This question isn't getting answered, and so they were able to monitor that. Rosa is the one that's kind of in charge of that group, and she was able then to use those reports and monitor that, hey, we're skipping this part, or this question isn't getting asked or whatever, and we were able to really tweak the system so that we were getting a good completion rate on all of our O&E stuff. So
Robert, does your O&E appointment, is that like scheduled back to back to a provider appointment they're coming in for? Um,
um, I don't know how back to back. I think they do try to do that. But I mean that will always come first. The O&E will always come first, and then whether they schedule it right away or I'm not sure exactly on the scheduling process, but I think they try to get it like, okay, you're going to see O&E at 10 o'clock, and then 11 o'clock you have your doctor's appointment or whatever. So yeah. I guess the other holdup is our translation process on that, because using the Genie program, we're eating a lot of minutes with that process, but it just the billing people really have expressed that it has really streamlined a lot of their billing complications and stuff. It's made their billing go a lot smoother and really helped them out a lot. So
awesome. Got a question in the chat. Does anybody use volunteers for O&E, or I'll expand that. Does anybody have volunteers working in their health center? No volunteers since COVID at Always. Let me see what else is on the list of possible topics. And like I said, if you have a topic you want that's not that wasn't in that email, or that I did that wasn't listed earlier, feel free to throw that in the chat. It's whatever topic is most important. I've got some to fall back on. So if you have a question, absolutely, let's talk about it. Hunter, they've got volunteers to help assemble outreach kits, but not their day-to-day operations. Health Partnership, they just used a volunteer to hire a pipeline to fill a role. They use volunteers for various tasks, clinical, non-clinical, and clinical volunteers require the same HIPAA and data privacy as employees. Okay. Let's talk chronic care management and annual wellness visits. The questions I've kind of gotten along these are who's doing it and how is it working? So, do you have a process for outreaching to your Medicare annual wellness visit patients that works well? If so, we'd love to hear it. Same with well child visits, commercial pay or annual preventive visit. Do you have a process for tracking and outreaching for that? Health ministries, they have designated staff for annual wellness visits and well child outreach. Okay. Do I have anybody here from Heartland? I was talking to Amy at Heartland about that, and she's not in their peds department, but she was telling me in their peds department, the only patients that are required to go to checkout are their peds patients, so they can get that next well child visit scheduled. So I do know that one is happening. Does anybody else have Medicare annual wellness visit process? Or alternatively, how do you manage the visit where the patient's scheduled for a well visit comes in and has other things going on and it's not just a well visit anymore? I wish I'm opening a can of worms because I don't have Maria here for the intricate coding questions, but I know that is something that has come up. All right, and we've got chat. Kim at Health Ministries, they schedule all of the first year visits at the newborn visit. That is brilliant. You get all of those first visits at the newborn visit. Okay, all of y'all that are in KCN, take note of that because that well child, the well child visits in the first 30 months, that is a big thing for the Healthy Blue contract. So, Kim, thank you. That is not something I would have thought of, but it's simple and brilliant. That's the best way. Danielle at First Care, the providers get longer appointments for Medicare well visits since they do take longer. Okay, yeah. Do y'all's EHRs have something that'll pop up and say, hey, this patient is due for their annual wellness visit? I know when I go see my provider, like I need a refill for whatever, it's like you need to come in for a visit, and that's how I know it's time to go back in. Do you have a thing on the EHR that says, hey, you're due for a preventive visit next month or something like that, either patient facing or staff facing or both? And then a follow-up question to Kim at Health Ministries. If one of the appointments have to be rescheduled for the first year newborn, the first year well child visits, do the remaining visits also get rescheduled? Kim at Health Ministries said they schedule the next year's well visit at the current year. Yeah, that's good. It's a good idea. And Brenda at Holy Family, Maria told us that Medicare does not allow providers to see a patient for any other reason than the well visit, and that includes refills and general labs. That is my understanding too. I just know I don't know any more than that if there's any nuance. And when I ask a question that's got coding tied to it, when I don't have Maria, it's always a little bit making you nervous. Danielle, at First Care, they schedule their well visits for the next year right away, and then they run reports to ensure no one is missed. Michelle at Health Ministries, for peds, they only reschedule the rest if they get way off schedule, otherwise they stay how they were initially scheduled. All right. Does anybody use the Azara report for annual wellness visits? I'm not 100% sure, but I'm pretty sure that there is a well visit report out there in Azara. Does anybody have one that they use, or is it all EHR based? Neither one is better than the other. Just curious if there's anything that anybody uses or if those are included on a dashboard anywhere. Dylan says their PEDS team might have started using it, but it's not common practice at this time. Okay. Follow-up question on the Medicare visit. Do you have, when the patient comes in for their Medicare wellness visit, do they do all of everything right there, or do they get any of that paperwork ahead of time to fill out? And adjacent question, do you have your RN do any of that, or is it on the provider? I was curious about the division of labor. Kim at Health Ministries, at their office, the team pre-fills out paperwork prior to the visit, and they have dedicated annual well visit nurses. Okay. Kim, do you know off the top of your head, just a rough estimate, how many annual wellness visits a day does your health center do? Up to 24. Okay. Let's see, how are we doing on time? We've got 10 minutes left. Holy Family, their providers would like to limit it to 5 per day per provider. Okay. If you have a pressing question for the group, be sure and throw it into the chat. We've got about 10 minutes left, so we can take a question. Danielle says that, yep, that's why they updated the length of time for the AWEs, because they are definitely more time consuming. Okay. And I'll keep an eye on chat to see if we get a question to come into the group, but let's otherwise look at GLP-1s. I've had recently some questions on what is the protocol for GLP-1s? Who's doing what? Is anybody doing anything? I've been reading some really interesting stuff, and there is a new pilot that Medicare is doing. I don't have all the details, but there's a Medicare pilot around GLP-1s, and it does include supported lifestyle management changes, which I thought it's really useful, because without changing what we do, we're not going to make any permanent lifestyle changes. So is anybody prescribing GLP-1s I'm assuming you probably are, at least for diabetics. So are you prescribing GLP-1s, diabetics, or weight control? And also, do you have any protocols that go with it? Any structured lifestyle management? Do you send them to your food as medicine? Anything like that? Michelle at Health Ministries, their prescribers prescribe a combination of commercial GLP-1s as well as compounded GLP-1s. Do you have any lifestyle change support, nutrition support, anything like that for any of um, your GLP-1 population? And Michelle answered, if the GLP-1's prescribed for diabetics, they see the in-house diabetic educator. And it's a capacity with the weight management patients to see the in-house educator. I can understand that. And it was interesting. The GLP-1s came up in conversation twice last week at two different health centers. So that was a recent add to the list. Kim at Health Ministry says they currently have a wait list for their food as medicine program. Crystal, do you want to talk a little bit about your food as medicine program out there in Hoxie? Marie and I were out there last week and we're kind of talking about this, and it was really, really interesting talking with them. They've got a behavioral health component, if I remember correctly.
So we have a cohort of 15 patients. I think it's a 3-month cohort, and you will be signed up for classes with a chef in town and our physical therapy department and behavioral health coaching if needed for any barriers or anything that's causing you to not be able to improve your health. It's with a grant through Sunflower. We've done food as medicine for diabetics and hypertension patients, and this go around we're just doing for anybody who's motivated to improve their health, whether that be weight loss or tobacco cessation or just learning to be healthy food wise.
One thing that came up in conversation, and Crystal, correct me if I'm wrong, but Jody and Crystal and their biller and Marie and I were all out there. And in conversation, Jody's like, there's a lot of people that are resistant to behavioral health for whatever reason. And it seems to be, I mean, you can say it's especially prevalent in this, that, or the other population, but, Ambermed, very rural, the farmers have a very high rate of suicide because they have, there's mental health concerns and they're kind of resistant sometimes to, I'm fine, I'll just tough it out. I'm not saying other populations don't, but that's the population they're working with. And Jody made a comment that she doesn't come at it from, it's not behavioral health, it's behavior. support. And I'm like, that is a fascinating turn of phrase to get around some of that mental health, that resistance to like mental health, or, I'm fine. I don't have any mental problems. The behavioral coaching or something. So I just wanted to throw that out there because just the way she phrased it, and I'm probably not phrasing it exactly how she did, but it really was like, yeah, words matter. And just that little shift in how she differentiated and kind of made it different than, oh, you have a mental health issue, was just fascinating to me. Sometimes it's just the littlest things it's like the little aha moment. So I just wanted to share that with you. And not saying that is strictly rural or strictly farmers, but that's the population we were talking about. Yeah. So we are pretty much out of time. Do not leave. We do have an evaluation. We definitely use those evaluations. Let me see if I can find it. I had it just a second ago. Let me pop that in
Here,
the
I'm
chat.
gonna
Does
drop it in,
anybody?
Heather.
Awesome, thank you. I'm like, I have too many windows over my Teams. Does anybody have anything else that they wanted to touch on today? Would love to do that. If you liked this session, please let us know in that evaluation. Sometimes these sessions, um, sometimes they can be challenging. I have absolutely no problem facilitating any of these. You guys have engaged really well. But if it's not what you guys want, please let me know and we'll do something different. If it is something that you do like and you want more, we can do more of them. So I definitely really, really, really would appreciate any of your feedback on this session and any suggestions for future sessions. And as always, if you have any questions or thoughts or comments you think of after we get off the call, please don't hesitate to reach out to any of us on the team. So thank you so much, everybody. Please be sure and do the evaluation, and I will talk to you guys again soon.